The main abnormality in coronary disease that's particularly lethal is the formation of thickening on the inside of the coronary vessels. So the plaques are basically narrowings inside the artery, and if the narrowing happens gradually over time, when the plaque is blocking the artery by more than 70%, you will have a situation oftentimes where a person, if they make an extra demand on their heart, they may not be able to increase their blood flow to meet that demand. Then there's a mismatch between supply, demand in the coronary artery, and there comes a point where people can develop symptoms of lack of blood flow, such as chest pain when they exert themselves. Believe it or not, although that's not a happy thing to happen, that's actually the less dangerous consequence of plaques forming on the inside of the arteries. The most dangerous thing is where the plaque becomes sufficiently inflamed that it eventually ruptures. And now the plaque contents escape out into the blood flow and start this cascade of clotting inside the artery. So you go from blood flow, even if it's slightly restricted, to no blood flow in a matter of minutes. That's what the heart doesn't like, is a sudden change in blood flow. Because if that happens and your heart continues to pump, you're in the middle of a heart attack and you need immediate attention, or your chances of dying are quite high. Even more dangerous, if it happens in about 1 in 4 people, the heart's reaction is ineffective blood flow. So the heart is pumping 1 minute, you block the blood flow because of the plaque rupture the next minute, and the heart's response is a very erratic, uncoordinated, still alive, but not effectively pumping blood flow, and that's called cardiac arrest. And unless you got somebody who's going to perform CPR or defibrillate the patient on the spot, that's where the person does the face plant, dies suddenly, and they can't be saved. So it's the plaque rupturing that is so dangerous in coronary disease, and the resultant sudden decrease in blood flow. Now, this plaque formation occurs mainly due to inflammation, which is, by a lot of research supporting the fact, mainly due to a diet that's high in animal products and high in oils. So people can restrict their calories, appear to be fairly thin, or go to the gym, or be very intense athletes and appear to have a healthy body on the outside. But if they continue to eat oils and animal products, they'll sometimes silently, or usually silently until there's a problem, form these plaques unknowingly. And then if they continue to eat that way, there will come a point often where the plaque becomes weak enough, it'll rupture and then cause a heart attack in an otherwise well person. We've heard cases, many cases where people are intense endurance athletes, like marathon runners, and they look great, they look extremely fit, and they come to the finish line and win the race and drop dead because on the inside their vessels are suffering the consequences of eating an animal-based and a high-fat diet, which sets them up for the production of these plaques, which are then at risk for rupture. So just because people are slim and look healthy on the outside, sorry to be a bearer of bad news, that doesn't necessarily mean that they're healthy on the inside. And the biggest predictor for that is going to be what someone's nutritional habits are.